CKD in non-dialysis patients. Previous 2 studies from Italy and Brazil on only dialysis patients, but this study is the pre-dialysis patients. So our homeopathic medicines are very beneficial to reduce the complications as well as to stop the improvement to the dialysis. So that is also very good. These 3 only RCTs found till now. So better hope. I think we are doing one more study shortly starting. That is also pre-dialysis study. Then now go for case series. This is the Bangladesh from Bangladesh. This case series is published. You see only results. So serum creatinine 11.5 to 2.9, and so mornings are also there. Don't pressurize with the serum creatinine level. So here this is the case series. Present highest creatinine levels to very good improvement. So 11.5 to 2.9, 14.1 to 1.5, 7.7 to 4.9, 3.3 to 2.4. So here he used only individualized medicine. The medicines are like that: lycopodium, epi, cefosinum, and beriberius. And he did not mention either he used standard treatment or not. Just he mentioned I used these medicines. These 4 cases are drastically improved. So this is a case series from Bangladesh. So it is also very good study. Don't visualize with serum creatinine, but even though follow standard guidelines, but there is a scope for homeopathy to reduce the serum creatinine. This is another case series from India only. This is actually retrospective study. That means they decided after they decided to search the literature. What are the cases came to them in the previous 1 year? Actually, you see the sample only 3 patients from suffering CKD treated for 1 year and not progressed to the dialysis. I mean 1 year he is under our treatment for 1 year and he is not going to the dialysis. Only those 3 patients are considered for this case series. So here also you see they use mother tinctures very well. So you see there are many alpha mother tincture, osimum, ravulfia and ethyl. So this is the study they used mother tinctures as well as the medicinal potency. They have a very good improvement in these 3 patients. I mean, even after 1 year treatment with homeopathy, they are not progressed to the dialysis. That is the outcome criteria. So actually, I am also one wrong notion that mother tinctures may not efficient in the kidney disease because there is kidney damage. If you are giving mother tinctures, there may be something complications may be happen because it is a physical material. So why? Because one of my known patient died. He is using mother tinctures as well as the standard care, but he is end-stage renal disease. But surprisingly, in my OPD, one patient came. His serum creatinine nearly about 4.5. He is already using 3 mother tinctures. One is Solidago, another one is Juniperus, another one is Eposin. These 3 mother tinctures, morning 5 drops, second one is afternoon 5 drops, night is 5 drops. So I thought that, oh my God, this is already CKD. If you are giving this mother tincture, because he already came from another homeopathic physician. I thought that it is dangerous. No, I have an experience. If you use mother tinctures, definitely it will damage the patient. Then I stopped. So okay, when 15 days is over, then I want to see what happened exactly to the patient. Then he came back and surprisingly serum creatinine became 7.5. So then I have a doubt. The only thing changed is I stopped mother tinctures and started Arsal. Why this creatinine is increased? Then immediately I started all the 3 mother tinctures. We can't damage the patient. He himself is showing creatinine. So again after 15 days I wantedly call him. Either these mother tinctures are really helping or not. Surprisingly same creatinine below 3 it came. But really I am wondering, but definitely it needs to be researched. How, in which level homeopathic mother tinctures will help. But surely there is definite 100% basing on that case experience, mother tinctures definitely will work in the CKD patients. So we will see in the future. Maybe first case due to end stage, maybe decline of the patient. But here it is maybe 4.5. So mother tinctures will be very good value in my experience. This is another case series. It is also from India. Hereafter the first publications only from Italy, Brazil and all. But later on is India is taking very good lead in the research what happened in the CKD. So these are all again 3 patients on dialysis. Then he given, here is the 50 musical scale was used first. So in last series they used mother tinctures, and this is the 50 millismol one. Duration 6 months. The outcome measure not the creatinine, not the outcome, only quality. What the madam said, na, the quality, palliative care. Palliative care, morning also madam said. The same palliative care approach was followed here, and then they can use this kidney disease quality of life. This is a small one, I mean. This scale was used, and so definitely the results are very, very good, especially in the areas of sleep, pain, and cognitive and emotional well-being. So what madam videos are clearly says, the sleep, pain, and cognitive function and emotional well-being. So even the end stage of CKD patients also madam's role only, because palliative care is very, very essential for the end stage CKD, because a patient on hemodialysis, he thinks that there is no life for him. But definitely if you use a comprehensive or a complementary mode of therapy, surely we will add life to them. Okay, the same dialogue, this is third time. First sir used, later madam used, now I am using. So this is again one more case series from India only. There are 5 patients. Again here outcome measures only estimated glomerular filtration rate and albumin creatinine ratio. There is a very good improvement in this case series also. Then this the case series is over. This is the case studies. This is actually ANCA negative. That is called anti-neutrophilic antigen actually, ANA. Negative rapidly progressive necrotizing crescentic glomerulonephritis. That is called rapidly progressive glomerulonephritis with ANCA negative. So this is very good and interesting case study. So how homeopathy will act in autoimmune disorders like this crescentic rapid progressive glomerulonephritis. Here you see a 60 years old Indian woman with RPGN. So intervention was used as carcinosinum ammonium gummy. I am also very newly heard this remedy, but this is a very good remedy for the kidney diseases. And sulfur in centesimal potency they used. There are 3 remedies: carcinosinum, ammonium gummy, and sulfur. 30-200 they used actually. The duration was 28 months. Here the outcome measures you see. GFR is initially 9. That means it's a very, very high end stage disease, but GFR improved after using homeopathy to 19. That is a very key of this. So we can improve the GFR by using homeopathic medicine. At the same time, serum creatinine 4.8 to 2.7. At the same BVAS score, that is called Birmingham vasculitis score. So it is commonly used in autoimmune vasculitis score. So it is also improved. So definitely this case shows there is a very good hope of homeopathy, or the scope of homeopathy, or the strength of homeopathy to treat like these cases. Then this is a purely a diabetic nephropathy case. So this is the one where the serum creatinine dropped from 4.9 to 3.6 within 2 months. So this is drug was lycopodium 200 CK. This lycopodium drug is commonly used in the literature of the CK. Then this is a basic study on rabbits. So it's from Pakistan. So it's a preclinical study. What the investigator did, he used Convallaria majalis mother tincture on the rabbits, and he monitored serum uric acid and creatinine after 14 days. Surprisingly, you see, the study reported improvement in the uric acid level, but not in the creatinine level. So this is his finding. But it is a basic study, I mean preclinical study on the rabbits. So where Convallaria majalis mother tincture actually he used mother tincture on the uric acid levels. So you can think about that hyperuricemia cases, you can use this Convallaria majalis. So this is a actually narrative review. So all the what happened till now, it is available in the net. You can read this paper. You will have a very good impression on the CKD management. This is other important cases which may not related to the CKD but related to the kidney. So that RPGN case is very, very interesting, rapid progressive glomerulonephritis. This is also very important. Chyluria case, where the urine is very milky. So diagnosed as a chylolymphatic malformation of the kidney. It is a congenital anomaly actually. So the patient is 24 years actually, yes. The patient is 24 years. So he used acid fast medicine, 200. Within 1.5 months, chyluria was absent. But here the post measured investigations are not available. But chyluria became negative, where the milky urine initially present, but within 1.5 month of acid was 200 C medicine. So the chyluria was cured. This is also gives very scope of homeopathy to treat. So non-complicated congenital anomalies. So this is a very good case. So chylolymphatic malformation kidney cured with the acid fast 200. There are many medicines are there, milky urine, but acid fast is good remedy. The same time Sina, Tuja, others also there. Then this is also one of the motivating case study where the renal cell carcinoma was treated with homeopathy. It's a very fantastic case study. It is the left kidney renal carcinoma. Patient aged about 45 years old patient. So here individualized medicine that is called antimonium prudum was given in the L1 potency bar 1 to bar 4. So it's a left-sided renal cell carcinoma. It's a drastically improved within 2 years. Along with all USG, LFT and KFT, CBC, all are became normal. But UCG, if you see the finding, it is not available here. You read this paper, the entire kidney will became normal after giving use of 2 years of antimonium prudum in L1 potency. So in even renal cell carcinoma, the homeopathy has a very good scope. Here what I found, any CKD is there, but it is not there. Serum creatinine normal before and after the study. But anyway, it is a very good. There is a health implications in this one. So definitely it is under CKD. So this is another case report. I already said a simple cortical cyst will be there and multiple ovarian cysts are there. At the same time, many morning also this story. This is also a very good study. So there are kidney cysts are there and ovarian cysts are there and bulky uterus is there. So the pulsatilla was given in the L1 potencies and post USG shows there is no cyst in the kidney. But here it may not come under CKD because the simple cortical cyst may not have health implications of the patient. So it may not come under CKD, but it is a good, you see, simple, this actually before 4.5 mm cyst is there in the kidney, after treatment there is no cyst found in the USG. So this is also very good. These are all interesting studies I found. Then exploring homeopathic coma, this is the IgA nephropathy study. So where a diagnosed IgA nephropathy patient was treated with Tuja as well as the eel serum. Here also they used ORIDL and MIMOP scales. Those are somewhat little bit better. Then this is the hypertension. Actually, the CKD due to hypertension. That means microalbuminuria due to hypertension. Till now we are seeing many diabetes and other causes. But the only study I found, even though it is published in the non-peer-reviewed journal, but to provoke you, yes, there is a scope of homeopathy in even hypertension-related kidney diseases. So they used sample size 32 and constitutional medicine were given for the 6 months, outcome parameters and BP as well as the urine microalbuminuria. The results are very satisfactory and we have a very good scope in the hypertensive nephropathy. So at a glance, this is the what I explained till now. There are 2 randomized controlled reported individualized homeopathic medicine including China rubra reduced the symptoms of lethargy and headache, asthenia and itching. So in chronic disease, you see first 3 are the first study and itching is the second study. And the patients on hemodialysis, another RCT showed that individualized homeopathic treatment reduced serum creatinine levels and improved kidney function in the pre-dialysis patients. This is the third RCT. So the 4 case series reported that is serum creatinine and improved kidney function and better quality of life with individualized treatment. So the 2 case reports showed ANCA negative and rapidly progressive glomerulonephritis and diabetic nephropathy. Here only one slide is there here. So a preclinical study reported Convallaria majoris in uric acid and case reports suggested benefits in the chyluria, renal cell carcinoma, simple renal cyst and IgA nephropathy. So one quasi-experimental study is there, the albuminuria among the hypertensive patients. Okay, this is a brief what I found in the literature. So entire a nutshell, this slide is an essential. So this is the scope and this is the strength till now. But what I am expecting from all of you. So here what should happen further? Because by 2040, CKD is the 5th leading cause of the death. So it's a comprehensive approach definitely we have to do something. So although these studies reported positive outcomes, most of the small sample size, because all case series only, very small duration, very thing. So poor reporting quality and not conducted in the standard guidelines. Therefore, current evidence supporting only benefit, but even it is very weak, and there is a further well-designed research study should be done. So we are going to start, I think, pre-dialysis study. So along with Tripura and Gudivada, so very soon we will start the pre-dialysis study shortly. So then this is a actually multimodal approach. So homeopathy medicine will support, but along with that, there are few lifestyle modification is very key. Morning dieters are also without reduction of smoking. There is no change in the lipid level. I mean cholesterol levels are LDL level. The same thing appears here. So you have to follow regular exercise, healthy weight, stress reduction, and tobacco quitting, and along with that nutrition regulation. But there is a ample of evidence that vegetable protein has more good in the CKD patients rather than the non-veg protein. So please prefer vegetable protein to the patients rather than the non-veg proteins. Then maintaining comorbidities like hypertension or diabetes. If you control, this is one more interesting case experience I will say. So one, I think 55 years male patient came with HbA1c is 7.1 and creatinine level is more than 4. So I am treating for 1 or 2 months as this pre-study. So surprisingly, after 2 months, HbA1c became 8 and creatinine is also became 5.6. Okay, then I referred to the nearby diabetologist and where he is already taking. Then the diabetes medicine, English medicine, not homeopathy. So in diabetes medicine was increased doses, and immediately after 1 month, HbA1c came down to 6.5, and the creatinine also came down without any renal medicine. Creatinine also came down to the 2. So I am this observing in many patients. So there is something relation between HbA1c and serum creatinine. So nearly I found 3 or 4 patients. When their sugar levels are high, the serum creatinine is also high. When their sugar levels is low, but their creatinine is also low. It is also one of my observation from past few months. So this also needs to be explained. Then there are many homeopathic medicines you know very well. So always constitutional is the better, 50 millismol is the better, and mother tinctures also you can try. So this is the conclusion. It is a very simple conclusion. So there should be many more is there to do in CKD. But till now what we can, so we have some scope in somewhere in treating the CKD. But we have to show the scientific community to be a good valid research. So scientific community won't believe this type of case series, case studies. These are the very lower level of the evidence. They want higher level of the RCDs. Definitely if we prove through RCD, homeopathy has a good scope in the homeopathy, then we can implement in a national programs or national policies. Because as madam is doing in a government sector by adding homeopathy to palliative care, the same thing will instruct by the government if we prove with a valid RCDs. So definitely we need a very good RCDs in the CKD in future. Then only by 2040 we are ready with our medicines to treat all the CKD patients. So anyway, my thanks for your postal and listening. So it's very hectic actually, but anyway I completed within my time. So thank you everyone, and by providing this opportunity I convey thanks.